Hello and welcome to Health Professional Radio. I'm your host, Neal Howard, on this Health Suppliers segment. Thank you so much for joining us today. Our guest in studio is Dr. Alejandro Badia, orthopedic surgeon in South Florida. His patients range from athletes to personalities. And just a couple of years ago, you decided to start the first and only orthopedic urgent care center franchise in the nation. He's here today to talk with us about Ortho Now, which began franchising in 2014. Good afternoon, Alejandro. How are you?
I'm great, Neal. How are you?
I'm doing well, and welcome to Health Professional Radio today. I'm glad that you could join us.
Thank you.
Ortho Now, it's actually making history as the first and only orthopedic urgent care center franchise. Are you in this by yourself, or just you and a team of orthopedic surgeons? How did it come about?
Well, like many good ideas, it came out of frustration. As a clinician, I'm an upper limb surgeon, so I noticed that every patient that came to see me had already been somewhere.
Yeah.
I soon realized, especially with all the healthcare cost challenges in this country, that was an incredible waste of money. Mm-hmm. And sadly, it was often detrimental to the patient outcome because either there was a delayed or frequently a missed diagnosis. So it occurred to me that patients should be able to access orthopedic injury and sports medicine care directly, not spend hours in emergency room to be told you need, here's some Advil, a splint, and you need to see an orthopedist. Mm-hmm. And that's how it came about. And I teamed up with someone in the business world who knew nothing about healthcare and learned it very quickly. And that's been an incredible collaboration. He's a Wharton School MBA guy from the Cornell Club that I met. I met him through the Cornell Club here, and he was on Wall Street for many years. And we've grown our corporate team.
Great. You specialize in urgent, disruptive orthopedic care. Did you see any need for just coming in for, general orthopedic stuff as an added service, or is it strictly ER emergency right now care?
Well, that's a great question. The uniqueness of it, of course, is when you really need it at that moment. Mm-hmm. Say, a severely sprained ankle, or you throw out your back and you have trouble getting out of bed, or you have a fracture, mm-hmm. or even a laceration that you need. But people are using it also coming in and saying, hey, my shoulder or my back's been hurting me for the past 3 years. But the problem is they have trouble accessing care. So they call the orthopedist, and it's 2 weeks to get an appointment. And, we've become very much a now society, and that's why people love our app. They can go to the Ortho Now app, find the nearest location, mm-hmm. and the new version will even have an Uber pick them up if their back is that severe. So it really is disruptive.
Are there separate, entities of the business that deal with sports medicine, and then a separate entity that deals with other disruptive types of emergency care? Or is it all inclusive at the same facility?
No, it's one facility, but the key with Ortho Now is the collaboration with other, healthcare delivery mm-hmm. Entities that you need. For example, some of our Ortho Now in Miami have an MRI within it.
Okay.
Some don't, because that's a big expenditure. So the MRI can often be done the same visit as long as the insurance company cooperates, which has actually been our biggest challenge. The flagship is also upstairs from a surgery center. So just yesterday, I can tell you a very famous fast food restaurant manager caught her fingers in a safe. She was seen at an occupational health center. They do their best, but they don't have that expertise. Mm-hmm. And she spent quite a few hours there. And by the time I saw her, fortunately, our operating room personnel was still present. And we simply brought her downstairs and took her to the OR and fixed her fingers. The same visit. That is very disruptive.
Now, let's talk for a moment about Doral, Florida. Now, you're a hand specialist. Are your centers, do some of them specialize in the hand to shoulder, and others specialize in leg injuries and things of that nature? Because some of them have, as you say, MRIs, some don't.
Right. No, we treat all musculoskeletal conditions, whether it be chronic or acute. The difference with the Doral Center, which is a flagship, is since I was the co-founder of the franchise, it happened that we put it in the same building where my upper limb practice is. So that's my elective hand surgery practice. That is a very separate entity from OrthoNow. The Doral location is currently somewhat unique amongst the other OrthoNow centers because it's located in the same building as a surgery center, a full-service therapy center, and all of the imaging modalities. Though other OrthoNows do have certain components, for example, the MRI imaging, ultrasound evaluation, etc. But what's unique about OrthoNow, any OrthoNow, is that you can walk in with virtually any musculoskeletal problem, whether acute or chronic, and get an initial assessment by somebody who understands this type of problem.
Let's talk about franchising opportunities. Where can our listeners go and get more information about OrthoNow franchising?
Sure, both potential franchisees and consumers of healthcare, which is really everybody can potentially have an orthopedic problem, right? Yeah. Anybody can find information at our website, which is orthonowcare.com. Now, at OrthoNow Care, there's a tab right on the homepage for franchise opportunities, and that goes into a fair amount of detail about what that consists of, including about a 3-minute video, which is an overview of the OrthoNow concept, but also talks specifically about franchising.
Discuss briefly the reception from other healthcare professionals when they learn of this brand new, groundbreaking franchising opportunity. Not only the franchising, but the company itself that offers this urgent care, specifically orthopedic urgent care.
Sure. I think everybody, virtually everybody, recognizes that this is a good idea. But I will tell you the engagement has been challenging, particularly from colleagues. I believe that other orthopedic surgeons often say, well, I can do it on my own, which is very true. But I can tell you personally how draining and what an effort and resources and time it is. And the reason we made it a franchise is we know that physicians are often very independent-minded, and this is a turnkey way to have your own OrthoNow without putting in necessarily the time. Other healthcare professionals obviously see it as terrific because we all understand that when you go to a general urgent care or an emergency room, you pretty much will be making a second visit to see the right type of specialist. So we have not had a lot of feedback from the hospitals. I'm not sure if they feel threatened by this or not, but I would think most hospital administrators would realize that their ER shouldn't be clogged up with people with ankle sprains, but rather that when someone comes in with chest pain or possibly with a stroke or with an orthopedic problem like a hip fracture or femur fracture, that they're not being encumbered by these minor injuries. That's not what the emergency rooms really were designed for.
You mentioned the OrthoNow app. Is it called the OrthoNow app, or is there some other name for the app? And is it available for iPhone and Android users as well?
Yes, for both. And the name is simply OrthoNow. And what's interesting is when you start typing it in, you realize that there's not a lot of other orthopedic, not a lot of apps even with a similar name. Interestingly, when our first version, we're now on we're on the second version, and we will be doing the third one next month. I believe it rolls out. And there was literally apps about Orthodox religion, and so ortho brings up various things. But the OrthoNow it's very easy to download. Obviously, it's free, and you can even notify a center when you're on your way. So when you walk in or limp in, the staff will be greeting you by name. That's pretty unique in today's healthcare services.
It's been a pleasure talking with you this afternoon.
Thank you. It's really it's a great pleasure to be able to educate people about a true innovation in healthcare, not what we've been brought in this country, just increasing bureaucracy. I mean, we can save on healthcare by simply changing how it's delivered.
Absolutely. You've been listening to Health Professional Radio, this Health Supplier segment. I'm your host, Neal Howard, and we've been in studio talking with Dr. Alejandro Badia, Franchising opportunities are available. If you'd like some more information, simply visit www.orthonowcare.com. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.